Well, in an exclusive interview to DD India, NITI Aayog member Dr. V.K. Paul spoke on monkeypox. He said there is no need to panic, but we still need to stay vigilant. Let's listen in.
Monkeypox spreads by close contact. It spreads through the secretions and the pus that occurs over the blisters and the skin lesions, and even the crust of the skin lesions can spread infection to the other person. It spreads from body fluids, including saliva, including nasal secretions, including semen and urine and other secretions. It also spreads by respiratory droplets, but not aerosol, as was the case in COVID-19. It also spreads indirectly if such secretions are lying on a bed, on a fomite, on a towel, and you are exposed to that. That could also spread. But certainly the spreading level or spreading capability of monkeypox is not like COVID. It's a closer contact, sustained contact, and it is something which spreads relatively slowly.
Is it fatal?
Yes, monkeypox can be fatal, but when detected on time and care is given under the care of competent doctors in isolation, then mortality rates are very low. It is not as fatal as smallpox was, to which it is related. So with care, the mortality is low, and even from the current outbreak of this disease in other countries, we know that the death level is low.
Any specific medicine?
The treatment is supportive. Treatment is caring for the rash, antibiotics, hydration, paracetamol, and so on and so forth. So treatment is essentially symptomatic and supportive, but under the care of the health professionals. Self-medication must be avoided. We must make sure that if there are those lesions on the palm, sole, and back of the palm and face, we must keep in mind that there are other diseases which could be even more dangerous than monkeypox. Therefore, correct diagnosis is very important. And if it is monkeypox, then supportive treatment will work.
How we can stop the spread?
First and foremost, whoever has the rash, face or over the extremities, should come forward, should get diagnosis done. It's important that we exclude other conditions which are technically even more serious potentially than this disease, such as chickenpox and such as herpes and measles and syphilis and so on. And very important that those are excluded. And if it is monkeypox, then those who have monkeypox also have to be cared for and are isolated, so that they are not spreading the disease. Isolated, they are not in touch, close contact with other people. It is the close contact which makes the disease spread. So isolate the patient, and those who have come in contact with this individual also have to be under watch. So that contact tracing is important, and watch and quarantine in a way of the contacts is important. So that's the chains of transmission then do not go beyond this set of individuals. And then those who are looking after, whether they are in the facility or if it so happens in the home, then they have to take precautions such as wearing a mask and ensuring that the fomites and the clothes are disposed of, taken care of, and other precautions that are required to be taken to protect themselves through direct contact with the secretion and indirectly through fomites and bedding and other clothes.
Any specific age group that is most vulnerable?
What we are seeing currently are these the adult population, but what we also know is that if monkeypox occurs in children, it could be somewhat more serious. If it occurs among pregnant women, then again the tendency for it to be more serious is higher. So we have to be more careful.
Very specific symptom and
Well, symptoms are relatively specific. The disease begins with fever. Fever is accompanied by body aches, muscle pain. Fever is accompanied by lymph nodes, which could be painful. And then within 2 to 3 days of this, the rash appears. Rash is in the form of blisters, like good old smallpox, but somewhat slightly different. Occurs on the face, and it occurs on the palm, occurs on the soles, occurs on the back of the palm. It can also affect the genital organs and perianal region, for example. Yes, that is very specific. But remember, similar rash or rash which could be confused with this also occurs in some other diseases. Herpes is one example. So, unless we make a correct diagnosis through test, we should not assume it is monkeypox, because other diseases have to be treated differently and they can have their own complications. So once such a rash occurs, please do not hide, do not do self-medication, get in touch with the health system, get your treatment done from a competent doctor. If you have the disease, you should be isolated. The hospital inpatient care is what you then require.